all, welcome to the AETCM, the Emergency Medicine channel. So first of all, I need to thank each one of you for supporting us. Of demands for our video, and one popular demand was to show how to use the defibrillator for cardioversion as well as for defibrillation. So before going to the details, the practical aspects, we will quickly look what is the difference between a defibrillator, defibrillation and a cardioversion. So for that purpose, you should know what are the indications for a defibrillation and what are the indications for a cardioversion. So first of all, let's see what is basically a defibrillator. Defibrillator was somewhere invented in 1950s. At that time, they tried to revert the ventricular fibrillation and they found it successful, and from 1960 onwards they have identified around to use the direct cardioversion. So that is a history regarding your defibrillator. So basically defibrillators are divided into maybe 2 or 3, you can say. You can have a biphasic defibrillator and monophasic defibrillator. So what we commonly see now is a biphasic defibrillator, which will have both the paddles will be delivering the current. So basic difference between a biphasic and a monophasic is that in monophasic defibrillator only one paddle will be delivering the energy, and in a biphasic defibrillator both the paddles will be delivering the energy. So suppose this is the heart, so the energy will be coming only through one pathway in a monophasic. When it is a biphasic, from both the sides both the paddles will be delivering the energy. So what is the advantage of that? When you think about monophasic defibrillator, you need a higher amount of energy to be delivered. So somewhere like 300, 360 joule. So the chance of trauma, everything is more. The electrical injury, everything is more when you are using a monophasic defibrillator. But nowadays, majority of the places we used to see the biphasic defibrillator, where we doesn't need a higher amount of energy, maybe 200 joules, maximum of 270 joules in some defibrillator. That all depends upon company to company. So there are a lot of companies. So that is a basic difference between a monophasic defibrillator and a biphasic defibrillator. And there is something else called as automated external defibrillator. Otherwise, we'll call it as an AED. We will show that in a separate video. In AED, it doesn't need any medical knowledge. You need to just attach the paddles, and the machine itself will recognize the rhythm and will say what to do in a case of a cardiac arrest. So that is AED. Maybe in our BLS video we have shown the AED, so you will understand regarding the use of an AED. So that is regarding your defibrillator. Now defibrillator are basically used for two purposes. One is for your defibrillation and cardioversion. So as the word implies, defibrillation means you have to fibrillate the heart by providing an external energy. Cardioversion, you are converting the conduction of the heart by providing an external energy. So that is the difference between defibrillation and cardioversion. Let's see what are the key features of defibrillation. In defibrillation, we use it only in a cardiac arrest where we find it is a shockable rhythms. So defibrillation means you are using your defibrillator in a case of cardiac arrest where you have a shockable rhythms. So next question arises, which are the shockable rhythms in a cardiac arrest? There are only two shockable rhythms in a cardiac arrest. One is pulseless ventricular tachycardia and ventricular fibrillation. So these are the two rhythms where you have to deliver defibrillation in case of a cardiac arrest. So again the question comes, what is the energy that you need to select? Always remember, defibrillation 200 joules if it is a biphasic defibrillator. If it is a monophasic defibrillator, 300 to 360 joules. So if you are not able to remember this joules per kg, just go to your defibrillator, take the maximum amount of energy whatever is available in the defibrillator and deliver the shock in case of a defibrillation. So that is first of all regarding your defibrillation. So remember, defibrillation we use it only in case of a shockable rhythm in a cardiac arrest, that is your pulseless VT and ventricular fibrillation. So that's all regarding your defibrillation. There is no synchronization, there is nothing else. We are just selecting the energy, that is the maximum amount of energy. If you are not able to remember, if you are able to remember, 200 joules of energy, that is a biphasic defibrillator. In case of a monophasic defibrillator, 300 to 360 joules of energy. So and you are delivering the shock. That's it. So that is regarding your defibrillation. So only in case of a cardiac arrest. Next coming is the cardioversion. So many people have a doubt. What exactly mean by cardioversion? Cardioversion we are using in case of unstable arrhythmias or refractory arrhythmias to your medication. So again, cardioversion we are using it for unstable tachyarrhythmias. What do you mean by instability? Unstable means your organ perfusion is affected. Something to the brain, the patient will have altered sensorium, to the heart, the patient can have myocardial infarction like chest pain, the patient can have breathlessness or hypotension. So if the organ perfusion is affected, and these are the signs of instability. So when you have a tachycardia, that is heart rate more than 100, and usually if it is in case of an unstable tachycardia, it will be usually above 150 to call it as an SVT, AF or multifocal atrial tachycardia, whichever it is, usually it will be more than 150. And in that scenario, if the patient is unstable, I said what are the signs of instability? You have to cardiovert the patient. So cardioversion is not just a simple procedure. You have to have little bit knowledge regarding cardioversion, and different scenarios you need to select different amount of energy. So first of all, what are the requirements for a cardioversion? For any procedure, that's it. You need to have a consent. You need to tell the family and bystander that regarding consent, you have to take that I am going to deliver a shock, maybe we need to sedate him. There is a high chance that he can go into a cardiac arrest also. If you are not treating also, he can go in for an arrhythmia and do a cardiac arrest. But this is an again painful procedure. You need to explain this to the patient, and proper procedural sedation is needed. So again, the question comes, what is the procedural sedation that is needed? Procedural sedation, you can use a smaller dose of midazolam or morphine or fentanyl. So that depends upon your institutional protocol. So definitely that needs a sedation, and you need to explain the procedure to the patient and take a consent from the bystander if somebody is available. That is ideally how cardioversion has to be done. And if the patient is having some chronic atrial fibrillation, we are not discussing regarding a chronic AF, we need to go ahead to a transesophageal echocardiography and make sure that there is no LA-LV clot. So if you are just delivering a shock when there is an LV clot, there is a high risk that the patient might go in for an stroke. So in that scenario, we are not discussing. We are discussing here for a new onset tachycardia and he has come unstable. You will be cardioverting the patient. So cardioversion, remember, you are using it for an unstable tachyarrhythmia or refractory arrhythmia to your drugs. So that is an indication for your cardioversion. As I told, consent and explain the procedure to the patient, and procedural sedation is mandatory. And here what we are doing is that cardioversion, we are selecting the smallest possible of energy to start with. So you know there are different types of arrhythmia. You can have supraventricular tachycardia, you have atrial fibrillation, you have multifocal atrial tachycardia, you have ventricular tachycardia where the patient can have pulse. So these are different types of tachycardia. So for that purpose, AHA have in ACLS, they have decided that a narrow complex, remember, a narrow complex regular tachycardia, it can be an SVT, you need to start with 50 joules. So a narrow complex regular tachycardia, you can start with 50 joules. We are thinking in terms of an SVT. A narrow complex irregular tachycardia, start with 120 joules, maximum of 200 joules. So that is your atrial fibrillation or multifocal atrial tachycardia. Wide complex stable tachycardia, that is again your ventricular tachycardia with pulse, start with 50 joules. So I will repeat it again. So narrow complex regular tachycardia 50 joules, narrow complex irregular tachycardia 120 to 200 joules, wide complex tachycardia, wide complex regular tachycardia, again you have to start with 100 joules. So you are selecting a smaller dose of energy, and preferably we will be using a biphasic defibrillator only. And after procedure sedation, after explaining to the patient, maybe you need to clean the chest also. Maybe if there is an very much of chest hair and all, it might not deliver the shock properly. Maybe you need to clean that area and you need to deliver the shock, and you need to see how the patient is responding or not. And in cardioversion, there is another thing that you need to see, that you need to select something called as synchronization. So it is, otherwise we can call it as a cardioversion is always synchronized. Synchronized cardioversion. What do you mean by synchronization? Synchronization is that the shock will be delivered by the machine at the peak of the R wave, or the peaking of the QRS complex, or the peak of the R wave only, the shock will be delivered. So that is regarding your synchronized cardioversion. So while you are delivering the shock for a cardioversion, you have to make sure that you are selecting the energy, and also in your defibrillator you have to select a synchronized button and you have to press that synchronized button and deliver the shock. At the time of delivering the shock, you need to hold it for a fraction of a second more, maybe 1 or 2 seconds, because the machine need to identify the peaking of R wave, and you need to deliver, the machine need to deliver the shock at that point. Because in defibrillation, we'll just deliver the shock and we'll come out. But in synchronized cardioversion, you need to just keep it for another couple of seconds so that that shock will be delivered. The machine will identify the peaking of R wave and the shock will be delivered. What is happening? What will happen if you are not synchronization? If you are accidentally forget to press the synchronized button, what will happen? the machine will deliver the shock, there is no point, but it will be sometime at the time of the refractory period. So as a result, the patient can go into an unstable tachycardia and unstable arrhythmia like VF, VT, and the patient can have a cardiac arrest. So already he is having an arrhythmia. On top of that, the heart will be in a refractory phase when you are not selecting the synchronization. So it's very important when you are going for a cardioversion, it always remember to do it as a synchronized cardioversion. I will show you the device and synchronized cardioversion. So this is basically your difference between a defibrillation and cardioversion, and the mechanism is the same, everything is the same. Now we will see the procedure in detail. So what are things that is needed before you decide to defibrillate? It is mandatory to have a defibrillator. Yes, you need to have a biphasic or a monophasic defibrillator. There are a lot of brands of defibrillator available. Make sure that it is adhering to the protocols and it is approved by the government of India or whichever regulatory bodies that your country has. So that is one most important thing, because there are a lot of substandard defibrillator that is available. Sometimes that shock will not be delivered, or it might be harmful to the doctor who is going to deliver the shock. So first of all, you need a defibrillator. I'll just see what are the parts of a defibrillator quickly. You will have a monitor screen like this, and you will have an energy selection button. So this is as I told, this is a Nihon Cordon one, and this has got an inbuilt AED mode, that is automated external defibrillator mode, as well as it has got an AED as well as an pacing mode also is available in this defibrillator. So these are the parts of a defibrillator. Then you will have two paddles here. Two paddles. One paddle you need to keep over the right side of your chest and one paddle over your apex. And you can see here something here. So this is the pediatric paddles. So both the sides, when you flip on this side, you will be able to see the pediatric paddles. And again in pediatric, the dose is 2 joules per kg for your defibrillation. So when you are planning to go ahead for a pediatric age group, you have to remove this and use this paddle. So this is the pediatric paddle. Next thing is that you will be having cables like this, 3 cables. So red to the right shoulder, yellow to the left shoulder, and green to your apex. So this is the placement of your leads, and you should be having your electrodes like this. This is the electrodes that is available. So you need to fix this on, and you need to fix over the patient's bare chest. So red over your right shoulder, yellow over your left shoulder, and green over your apex. So these are the 3 things that you need to connect. In certain scenarios, certain hospitals, you might able to see something called as an adhesive bandage. This is an adhesive bandage. What you can see here in the image clearly, this is one to the front and one to the apex. So this is an adhesive bandage. If it is available, you can easily stick it on either side. There is no need for your 3 lead. You can use this adhesive paddles also. So this is very important when you are patient is on prone ventilation, so you need to defibrillate. At that time you can just flip around the patient. It will be more effective while you are using an adhesive paddles. So that is one regarding your adhesive paddles, if it is available. And again you can see this is the, I have switched on the machine.
Adult mode. Use disposable pads.
This is the AED mode, that what I have switched on. Now we can see I can select the energy. See here, I have selected 270 joules. That is the maximum, or you can start with your 200 joules. There is no harm. So 200 joules is the recommendation in a biphasic defibrillator, and or if you are having any doubt, select the maximum joules. That is the 270 joules. So once you select the amount of energy to be delivered, then what you need to do? The next thing that you need is something called as an gel aid. You have to have a gel, because you need to have a very good conduction between your paddles and to the skin, and also the skin should not burn while you are giving your shock. So you need to have this gel to be applied between the paddles and the skin. Both the paddles you need to apply. So this is the other one that you need to arrange, and it is obvious that you should be doing in your resuscitation area. So all your resuscitation equipment has to be there. You are monitoring NIBP stuff, oxygen availability, everything needed to be there. So you have seen the parts of the defibrillator. I will explain it again. So this is the monitor, and you have the energy selection here, and you have the paddles. I have shown you the pediatric paddles also, and it has got an AED mode. And you see here, this is the sync button, which I said for your cardioversion. This is your synchronized button. And again, there are certain other things like lead selection here. You can select different leads. Usually we will go for the lead 2 here. So lead 1, lead 2, that is what we need to select. And sometimes in case of fine VF, we will not be able to identify the fine VF, so we can increase the sensitivity here. So 0.2, 0.5, 2 millivolts. So it can increase as well as decrease the frequency, and there are various other buttons which can help you in retrieving the data and all those things. So this is the basic parts of your defibrillator. And one more additional thing, sometimes you don't find this adhesive electrodes. You can keep the paddles with your gel to the chest wall. The machine will recognize the rhythm, and you can see the rhythm in the monitor, and you can see whether it's a shockable or a non-shockable rhythm. The scenario is that you don't have this electrode. Somebody has misplaced this cable. You only have this machine. Still you can keep this thing over the patient's chest, and you can see what is the rhythm. The only thing that you need to do here, I have shown you here the lead. So you need to select the lead as the paddle. Lead as a paddle. So the paddle will give you the details for that. So that is regarding your defibrillator, parts of defibrillator. Now coming to the procedure. First let's see defibrillation procedure. We have decided to go ahead with the defibrillation. I am not discussing that because that comes in the cardiac arrest algorithm. So you have your team member, your team leader has decided that this patient needs defibrillation. So your procedure for defibrillation, what are the steps for defibrillation? First thing is that you have to select the amount of energy, and you have to make sure these paddles are connected, and you apply adequate gel over your paddles. And the next thing that you need to remember, that you need to shout that everybody should be clear, not touching the patient. You are going to apply a direct current. Nobody should be touching the patient. The next thing is that you need to shout once or twice, and also make sure that your oxygen source is cut off. Nobody is touching the patient and oxygen source is cut off, because there is a chance of inflammation also. So you need to make sure that these things are not happening, and you defibrillate. Where to keep the paddles, I said one over your right side of the chest, just lateral to your right border of your sternum, and one over your apex, that is your anterolateral. Then you have your androposterior. Right side it is the same, and posteriorly just below your left tip of the left scapula. That is the two area. Suppose this patient is having on prone ventilation. In COVID scenario, sometimes the patient might be on prone ventilation. At that time, what do you need to do? You can keep on both the side of the axilla. So you can use these adhesive paddles. That is better in case of prone ventilation. So these are the position where to keep your paddles. So first step, you have selected the, you have switched on the machine. You have selected the energy. The next thing, that before touching the patient, you have to make sure that no one else is touching. Before delivering the shock, make sure that no one else is touching the patient. And you need to, now we have selected the energy, but this machine is not charged. This paddles is not charged. This paddle doesn't have any energy. So at this point, what you need to do, there is something called as a charge button here. There is a charge button on the side. You can see the charge button here. This is the charge button. Or else you will have a charge button here also. So you need to charge the defibrillator. So then only the paddles will be having that energy. Once it is charged, you apply the paddles wherever it is indicated. As I told, one over the right side of your sternum and one over your apex, and make sure that no one else is, very important, because many of these things can go wrong. So make sure that no one else is touching. You shout, and you can see the shock delivery button here, 2 button here, and you need to press this 2 shock delivery button and deliver the shock and resume the CPR. So that is a method that you have to adopt for your defibrillation in case of a cardiac arrest. And most importantly, there will be an indicator. You can see a small indicator here. So this indicator will show you the contact, because if you don't have an adequate contact with the chest wall, it will not be delivering the shock properly. So you should have a proper contact to the skin wall. So this light should be green. There are different methods in different defibrillator. Some don't have this indicator, some have this, but this machine have this indicator. So if it is showing a green light here, that means the contact is good. Then only the shock will be delivered properly. So that is regarding your defibrillation. Cardioversion, the procedure is the same. We have told, we have to get consent. The parts, everything is the same. You can use either adhesive paddles, or you can use the routine paddles, and you need to deliver the shock. But remember that you need to switch on the sync button and keep the paddles at least for another 2 seconds, so that the machine will recognize the rhythm and it will deliver the shock. And depending upon what happened to the next shock, you can decide on further treatment. So briefly, what we have discussed is here is the how to indications for your defibrillation and cardioversion, what is the difference between the both, and how to use your defibrillator. You understand? that very important thing is that you need to check the device before going for your duty, because sometimes the machine will be malfunctioning. At the time you have a patient with cardiac arrest with ventricular fibrillation, you are trying to use this machine will not be working. So always make a point that you always check your machines before entering into your duty, because this is a life-saving equipment. If it is not working, it is done. There is no other treatment option for your VT-VF in a cardiac arrest. The treatment of choice is defibrillation. So parts of defibrillator, the monitor, how to select the joules, what are all things we have discussed. Thank you for your patient listening.